Tu taua mai I runga, tu taua mai I raro, tu taua mai I roto, tu taua mai I waho. Kia tau ai te mauri tū, kia tau ai te mauri ora, tū tura whakamaua, kia taina, taina, haumie, huie, tai kie. Well, tēnā koutou katoa, ko Gregor Fountain tāku ingoa, no Ngāti Pākehā hau. Ko te iha Aotearoa I mahi ana Arano Sport New Zealand aho. Tēnā koutou, kia ora tātou katoa. Can I just reiterate my welcome to all of you and thank you for giving up time to explore this really important and interesting issue with us. As you know, today's session focuses on the ways in which physical activity can contribute to improved mental health outcomes. And we've got the subtitle, Translating Research into Practice. We've deliberately timed this session to coincide with Mental Health Awareness Week, a time when we can all be thinking about what we can do more deliberately to make our communities places of that people are well, and things that we can do personally and collectively to ensure that that we are giving ourselves the best opportunities to be well in this challenging world. So today, as you will know, we've got two speakers. We've got Professor Stuart Vella, who's joining us from Wollongong University. Say a little bit more about him in a minute. And also Dr. Matthew Jenkins, who actually is joining us from Japan, from a room which has got quite bad Wi-Fi. So, but what's great is he's actually pre-recorded his message, but he'll be on his phone to answer any questions at the end of the session. We don't have time to go around and introduce everybody, but we'd love to invite you just to use the chat function as we start, just to identify where you are. Are you in Wellington? Are you in Hamilton? Which part of New Zealand or around the world are you? And if you're part of an organisation, maybe you could just also put that in the chat. So yeah, I'm Gregor. I live in Newtown, Wellington, and I'm part of Sport New Zealand. So yeah, please use the chat to tell us where you are and where you've come from. So we've got a sense of who's on the call and we can make some connections with you. I'm going to move on to our first presentation today, and I'm going to start by introducing Professor Stuart Vella. Stu comes to us from the University of Wollongong. He's also the director of the Global Alliance for Mental Health and Sport, and he's also the Mental Health and Sport Research Advisor at Movember Australia. And in today's presentation, he is going to be addressing the title, Filling Gaps and Creating Impact, the how and why of guidelines and consensus statements in mental health, sport, and physical activity. Now, Stu, I suggest we just take just wait for maybe a minute while all our colleagues and friends are telling us where they are coming from, and then we'll ask you to take over and take this next little period to take us through your presentation.
Sure thing. See that they're still coming through here, thick and fast. So well done. Just give me a thumbs up, Gregor, when you want me to start. But I'll while they're all coming through, I do want to just acknowledge the Dharawal people on whose lands I live and work. The Dharawal people have been here for many years. And we just acknowledge the Dharawal people and their ownership over the land here I'm in Sydney. So just wanted to start with that one, but seems like we might be slowing down.
Yeah, take it away, Stu.
Alrighty. So I'm just going to talk a little bit around the how and the why of guidelines, but I think essentially the why of guidelines is pretty much in line with the topic of this overall seminar, which is translating research into practice. I think for me the overall purpose of developing guidelines is really just to bridge that gap between what we know that or what we think the evidence is saying, and what we're doing in practice, and often those two things can diverge for many different reasons. Sometimes practice, in terms of mental health especially, sometimes practice is a little bit ahead of research. Sometimes research is a little bit ahead of practice. But essentially, guidelines are just, in my opinion, we're just trying to bridge this gap. Gregor, you might just want to jump onto my set of slides. I don't know if I'm seeing the same ones as you, but if we can just jump onto the next slide. I'll talk about two sets of recommendations or guidelines that I've developed or led the development of in Australia, which is the National Mental Health Guidelines for Community Sport. And the second one is a consensus statement for optimizing the mental health benefits of physical activity. So I'm going to talk about both of
Stu,
those.
we've got your title slide up now. Is that not showing for you?
It's not showing for me, but no problem. We'll just carry on. I'm cool. I can actually control my own slides here for some reason, but we'll roll with it, and I'm sure we'll be fine.
Okay, I'll move on to your first substantive slide now first then.
Yeah, no worries. I think in both cases, in terms of the physical activity guidelines and also the mental health guidelines for sport, essentially we are just trying to fill a really critical gap between research and practice, and then trying to give, I think, very simple, clear, actionable recommendations is really the key in order to try and create impact or influence practice. So the mental health guidelines for community sport, I think, I had this experience, or a couple of experiences really over the last couple of years, which I think talk really well to the need for guidelines like this. My friends and I play in an over 35 futsal competition, and being the elder league, we have some health problems, and we did have an unfortunate incident where one of the players on our team did have a heart attack while playing, and some of my friends were there administering CPR, and I think that just the impact of events like that can have on one's mental health is quite profound. And we find ourselves asking questions like, what's the role of the club, the sports organisation there in terms of providing support to those guys that were the first responders there? A second example is my son plays soccer. I was serving in the canteen. I don't know how it works in New Zealand, but I imagine it could be very similar. Each parents take in turns of serving in the canteen for the club, and this particular canteen happens to be next to the kind of the room where teams come in and have their halftime talk. And as I was serving in the canteen, this under 14 boys team came in, and the coach just really started ripping into them, a lot of profanity and just, really, really what I would consider unacceptable, abusive behavior. And then it begs the question, what's the responsibility of the club in that situation? What's the responsibility of the club in trying to provide a psychologically safe environment for all participants, be those young men, young women, coaches, referees, whatever it is. And so essentially these are the kind of situations which pop up every single week in terms of community sport. And then we have this change in societal attitudes around mental health and sport in particular, where sports clubs are now starting to recognise an obligation to protect the mental health and promote mental health of all their participants. So essentially this is the foundation of these guidelines, trying to bridge the gap between the research and practice for these kinds of situations. And essentially what we came up with is a set of very minimally acceptable standards of governance. When you're kind of working through what a guideline should be, it's not always obvious what a guideline should be. Should it be aspirational? Should we say this is what, ideally everyone would be doing, or is it just a minimally acceptable standard of governance, which is in the end what we've come for here. But in terms of the how of guidelines, it's not always easy to kind of, think through where do you pitch the guidelines. But given the relative lack of guidance that was out there already, what we've pitched for is a set of minimally acceptable standards of governance. So you can understand these as kind of what we want clubs or sports organisations to do as a minimum, and then you can think, we want them to be fairly easy, implementable, action-oriented things that can be done. Gregor, we might just move on then. And in terms of the how, I won't go into this, but essentially what you need to know is all really evidence-based. You review all the evidence that's out there, and in the end, writing the guidelines is a little bit of an art. It's a little bit of a science, but it's mostly art, in my opinion. You kind of bring all of this different evidence that we have together. So all of the programs that are out there, all of the existing evidence on promoting mental health in community sport, all the existing guidelines. We have an expert consensus study as well, stakeholder co-development. And so you kind of bring all of this together to kind of put into some form of minimally acceptable, actionable recommendations. And so I'll just talk really quickly through each of the 9 guidelines that we have for sport. So the first one is around mental health literacy. And so at a minimum, community sport organisations should demonstrate a commitment to enhancing the mental health literacy of their key stakeholders. And for us, this is, as I said, the minimum being that those people that are essentially, when I say key stakeholders, it's really those people that are making decisions within the club. You're looking at presidents, vice presidents, committee members, those people who are making decisions, putting policies in place within the club. They should have a basic mental health literacy. So that's the minimum. And then if clubs wanted to do more, for example, they could train coaches, they might train parents, they could run mental health literacy programs for players, for referees, whoever. But at a minimum, we're looking at the key decision makers within a sports club, at least operating with some basic mental health literacy. The next one are we call referral pathways. But basically, we're just saying that community sports organisations should be aware of what appropriate mental health services are available within their local area, how to access them. It would be better if they had some awareness of how long the waiting list might be. I know in Australia we have very long waiting lists for basic mental health services, but essentially, we recognise that the club is not responsible for treating the problems or anything like that, but basically just at a minimum to have some awareness of what services are available and where they can point people to at any given point in time. And we say if they want to do more, so that's the minimally acceptable bit, is just to be aware and have those probably written down. If they want to do more, they could establish relationships with a service provider, and that might come in handy for some of the following guidelines where you might want to lean on a mental health service provider to develop some of your action plans and so on. The third guideline is what we've called mental health emergencies. And so you might think of this as someone who is having an episode of psychosis, for example, someone who might be having suicidal thoughts, and they're kind of in or around the club. That was something that we consider a mental health emergency, and just really saying, have a plan for how to respond to that. This is something where we can provide a guideline, not a guideline, a template for clubs. But essentially, this is where kind of having those established relationships with an appropriate mental health service provider could come in. We're not saying that the club needs to be able to deal with it, but just at least know who you're going to call. Are you going to call for us, 000 emergency services? Just know what you're going to do. I think is kind of the take-home message for this one. The fourth guideline, major events that impact mental health. So I gave a short story about one of our friends who had a heart attack on the futsal court. Those kind of things would be considered a major event that might impact the well-being of those people that were there. The other thing is, we get a lot of, whether they floods, bushfires, natural disasters that are in and around sporting clubs. There might be the death of someone within the sporting club, for example. There are lots of things that might impact the mental health and well-being of people within a sports organisation. And so, again, we're not saying that the sports organisation needs to be the one to deal with that, but just know what you're going to do, who are you going to call, what kind of things are you going to do in order to be able to protect and promote mental health in those circumstances. And that's particularly kind of, I know in Australia, in some regional towns, for example, the sports club can be the hub of the community, the centre of the community, and those kind of events can really rock a sporting club. And so having those plans, I think, are really important, especially in those contexts. The fifth guideline is just around stigmatizing attitudes. So we're saying that clubs demonstrate an ongoing commitment to promoting positive attitudes about mental health and well-being. So that might be through educational approaches. It might be through contact approaches where people might come in and in a safe way share their story around mental health. It might be just around talking openly about mental health within the organisation. It might be putting mental health explicitly into the club or organisation priorities, their values, their mission, but really just being very open, talking openly about mental health to try and kind of minimise the stigmatising attitude that exist around mental health and mental health help seeking. Next one is coach education. So again, it speaks to the story that I told just around coaches really that aren't operating in a psychologically safe way. So what's the minimum obligation then of an organisation? So we're not saying that they're responsible for everything coaches are doing, although ideally they would be, but at a minimum, we're just saying, look, they need to support their coaches in terms of coach development to promote safe and supportive coaching. And I use the phrase psychological safety, but it's not necessarily psychological safety in terms of coach education. There are lots of coach education programs that are out there. If you look at things like autonomy supportive coaching, transformational coaching, mastery approach to coaching, they're all kind of slight differences, but in essence, it's just like really good quality coaching practices is what we're talking about. And we're not talking about the kind of technical, tactical kind of performance skills. It's really just the interpersonal aspect of coaching that we want some development in there for sports coaches. And whether that's one of those existing programs, there are lots of coach education programs out there. We prefer an evidence-based one, or it might be just getting a sports psychologist, for example, to come in and run something there in terms of some evidence-based coaching principles. Moving on to number 7 is the promotion of well-being. So it's kind of more of if you think of all of the others as kind of being, around protecting mental health, this one's really much more around promoting well-being and promoting good mental health. And we know that just, participating in sport is good for mental health on average. It's not good for everyone, but on average, there are benefits. Most likely benefits for participating in sport. And so it's how do clubs really lean in and optimize the well-being benefits. So we look at things like giving people an opportunity to contribute to something that's broader than themselves, giving them an opportunity to contribute to the organization, promoting inclusivity, providing a really inclusive environment for everybody, promoting the good quality social ties, and lots of opportunities to engage socially within the club. We might look at things like trying to get high levels of physical activity in practices, serving, good quality, nutritious food in the canteens, or the responsible service of alcohol within the sports club. All of these things, kind of tie into the promotion of well-being within the sports organisation. And then the last two, first is mental health role. So basically saying, like, let's have someone responsible for all of this. Let's actually try and get it. It may be one person, it may be a number of people, but let's actually make this somebody's role to oversee and contribute to the implementation of all of these things. And I think that's really important, that in community sport, often the turnover is really high. So having something in place is really important. And that speaks to the last one, which is just having an action plan and having that written down. And so that will live on beyond, that one person or a couple of people if they happen to leave the club. So just keep moving through there, Gregor, onto what this might look like for a sports club. You might take for example, a 3-month or a 90-day starter plan and just start to work through things. You might start by just appointing a mental health champion and formally adopting the framework. You might run some mental health literacy training, so mental health first aid or whatever that might be for the key people within the club. You might map out some local referral partners, and then as you get on, you might look at adding the protocols for emergencies or critical events, might run some coaching and so on. So it doesn't have to be, kind of this big hoo-ha, but I think you can just, as a club, start to kind of work your way through those kind of 9 guidelines. And just in the interest of time, I'll continue moving on. I'm going to take a little shift now away from guidelines in sport to a consensus statement around using physical activity to optimize mental health, or optimizing the mental health benefits of physical activity. And for us, the big gap we were trying to fill here is we know, most countries, New Zealand, Australia, we have physical activity guidelines, right? It's 90, 100, 150 minutes of moderate to vigorous physical activity per week. And those really focus on those guidelines that we have at the moment. Focus, apart from type, they focus exclusively on kind of the quantitative characteristics: time, frequency, intensity. And so that doesn't necessarily provide a lot of guidance for practitioners. If I'm a psychologist or a social worker or I'm a GP sitting with someone, what actually am I going to tell them to do? Do I just tell them to go and do 150 minutes of moderate to vigorous physical activity, and is that that's going to be good for their mental health? It will, but can we optimize the type of physical activity that people are being guided to do? And so for us, it really is just trying to fill that common sense gap around physical activity recommendations. In terms of the how, again, I think if you just take from this that these are really kind of evidence-based, and these ones in particular, the sport ones, we kind of reviewing the evidence, but these ones we're kind of reviewing reviews of the evidence. So it's kind of really high level. There's a lot of evidence here on which to base these, although because I will say here that the focus has typically been on those quantitative, like the intensity, the frequency, the duration. And so I think we can get better evidence, but there is already a lot out there nonetheless. So essentially what we did is we tried to define what it is that we wanted to look at. So we looked at these 5 characteristics, and we call them kind of contextual factors. It's kind of, well, what should we tell people to do? Where and why should they do it? Where do you do it? With who do you do it? And how should that be delivered? These are essentially the questions that we're asking and trying to provide guidance on here. So in terms of type, I'll just quickly run through these 5 because I'm running out of time, but essentially with type, there's no one type of physical activity that's best, but it really should be around making sure that people are doing something that they enjoy. That's the most important, because adherence is really important. Focus on factors such as access, and take into account individual preferences and factors. So type, we're not really strong on the recommendation here, but it's something that people should be able to do easily and they should enjoy. On to the next one, which is delivery, and it's really, we're looking for something that's delivered in a way that meets individuals' basic psychological needs. So need for autonomy, need for social connection being the two most important. So people should, through the delivery of that physical activity, feel like they have some control over what they're doing, and they should feel like they've got positive relationships there. And so the delivery is really, really important. We know that instructional style can really dampen or enlighten people's motivation, and so we need to have a focus on that. However, we also acknowledge that psychologists, GPs don't have a lot of control, but I think you just need to take this into consideration. The one thing we did find that in clinical populations, supervised physical activity is better than non-supervised. In terms of the social environment, a lot of people, myself included, prefer to be physically active alone, go for a run, and it's kind of a bit of a me time. The evidence shows us that if you can be physically active with friends, that's better. It tends to have better mental health benefits. So we should encourage people to be active with people, with others who provide support, who provide positive interactions, or who make people feel valued, so long as it doesn't undermine a preference to be active alone, noting that there are mental health benefits of just having some, alone time, getting out and not being with anyone. In terms of the physical environment, I think the evidence is pretty clear that being outside is better than inside in terms of mental health benefits of physical activity. So if you can do some in green or blue spaces, so in parks, on the beach, those kind of things, that's better than doing it inside or through a concrete jungle if you can. And then lastly, in terms of domain, what's really interesting is that leisure time physical activity seems to be most beneficial for mental health. So if you think of the different other domains would be like work physical activity. So if you're walking for work, if you're active for work, that doesn't necessarily have the same mental health benefits as choosing to be physically active during your free time. So that's really what we're getting at here is around how do you use your free time, and during your free time you should choose to do some physical activity in order to optimize the benefits. So in terms of a summary of these are really evidence informed. They're prescriptive. We just intended to help guide practitioners, definitely not dictating what needs to be done. We know that any movement helps. Physical activity supports mental health no matter what it is. And we should use these alongside the existing national physical activity guidelines, which talk about frequency, intensity, and time. We're really encouraging a very pragmatic approach and really think menu of options here, not necessarily a checklist approach. It's just how can we make some little tweaks to enhance the mental health benefits of physical activity. And that's it. I'll finish there. Hopefully.
Thank you.
Time, Gregor.
Thank you, Stu. Yeah, amazing effort. Really, really great timing. Really interesting to consider, our clubs and sports clubs as places, where can have good impact on mental health, but also if it's not the right environment, it can go the other way. And those examples you mentioned are ones that really relate. I have some experience with as well. On the chat, Hillary commented about how practical the guidelines were. She's asking, when are the guidelines due to be published? Are they already out?
Yeah, so they're both published in academic outlets. Hillary, I'm not sure which ones you're referring to, but if it's guidelines, maybe it's the mental health and sport ones. Yeah. We have published them. I'm happy to provide any of those to people here. We do have some more public-facing, public-friendly documents than the academic outlets, which I'm really happy to share as well. And we're just going through we've done some case studies around implementation and then just working through the best way to scale that up. But absolutely can provide those to you, which kind of gives you a more of a practical how could it be done? Why should it be done? When can it be done? Who's responsible? I can provide that document maybe to you, Gregor, and you
Yeah,
can forward it on to everyone
yeah.
here.
Yeah, we'll be able to use the sport tutor process for that. Just one question from me before we
Mhm.
move on to the next presentation. Um, just interested in the role of parents in these kids' clubs. What advice would you give the people that are running these clubs about parents being, ensuring or taking actions that make it more likely that the experience is going to be a positive mental health one for the kids?
Mm, yeah, that's a big one, Gregor, and that's an omission from the guidelines for sure. But as you mentioned, parents are so critical in terms of, you just think of things like the car ride home. Um, these are where kind of the rubber hits the road in terms of kind of really impactful moments for kids. Um, so I would say that clubs can work with parents, and certainly the triad of athlete, parent, coach is a really important one too. So it's like, how do we get parents on board in terms of the clubs or the sports organizations' mission, their values. And so essentially it's trying to get buy-in from parents, trying to reinforce the messages that the club wants. But it's very, very difficult. I think we've typically found it difficult to engage parents in education. That's one that we haven't cracked yet, and I think one that we'd be open to continuing to look at. And certainly, I know Movember would be open to looking to fund some more stuff in this area to kind of crack that, because it's a really important nut to crack, and I don't think we've cracked it well.
I think that just your framework around being deliberate about it and having a specific plan, even that would go a long way for people saying, "Gee, that didn't feel right or didn't look right." And so I
Yeah,
think, just the fact that you're deliberate about it and people are thinking about it and you've got someone looking at it, I reckon would, be a really good first step. It's harder to walk away if you've already talked about it, and able to
yeah,
respond to those things.
absolutely agree.
Thank you so much. We are going to have about 10 to 15 minutes at the end where we hope to have some more questions and conversation. I'm going to move on though to our second presentation. And this comes from our colleague and friend, Dr. Matthew Jenkins. Matthew is a senior research fellow in psychological medicine at the University of Otago, based here in Wellington. And he's also a partnership manager at Nukuora, which is the regional sports trust here in Wellington, formerly known as Sport Wellington. Matthew's work focuses on youth mental health, physical activity, and particularly in the area of first episode psychosis. And today's presentation from Matthew focuses on is entitled Te Whaiora, co-designing for Hauora within the early intervention services. So you might see on your screen that Matthew's he's sitting there on his phone in Japan, where he is at the moment. He's giving us a wave. So he very sensibly has recorded his presentation. So we're going to do that, but he'll be here at the end to be part of the conversation, which I'm sure will come out of it. So
Tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko Ingarangi, ko Wera, te whakapaparanga mai, ko Solihull, te whenua tupu, engari kei te tapituranga aho, e noho ana, ko Keegan, ko Squire, ko Thorne, ko Jenkins, toko whānau, ko Fiona, toko wahine, ko Nia Ray, toko tamahine, ko Matt Jenkins, toko ina, nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Kia ora everyone, my name is Matt Jenkins. Just a huge mihi to Justin and the team at Te Hau Kori and Sport New Zealand for hosting this seminar. such an important week in terms of mental health awareness, but also looking at how physical activity can influence mental health. So really cool that I've been invited to talk at this, and also huge mihi to Stu for talking at this seminar as well. So hopefully I can lead into from some of the stuff that he's been talking about. Specifically, I'm going to talk about a project that we've been doing for the last 4 years now. So Te Hau Kori, the journey to wellness, and it's all around co-designing for well-being with young people living with psychosis. Big quick shout out to Dr. Victoria Chin, who's my sort of partner in crime in this co-papa at the Victoria University. Myself, I'm a University of Otago Senior Research Fellow, as well as being a Partnerships Manager at Nuka Order, our regional sports trust here in Wellington. Before I jump into the project itself, I just wanted to show a quick video that speaks to why we do what we do and that co-papa. So bear with me.
I was diagnosed with psychosis at 21 years old, coming on 5 years ago. And I've been in hospital twice due to psychotic episodes. I experienced manic depression, times of mania where you feel really high and happy, or really energetic and buzzing. And then depression where you just feel really low, can't get out of bed, find bed the best place to be, or just a dark room, you know. When you get diagnosed with psychosis, it can kind of make you feel a little attacked just because of stigma around mental health being a really negative and crazy thing. So you don't really want to be around people, be seen. And so going for runs or going to the gym where there's quite a few people can be quite daunting.
Kia ora. So that's Bryony. She's one of our research team. So we've lived experience of psychosis, and I'll talk to her again in a second. But really speaks to the reasons that we do this May. Generally speaking, psychosis, health and well-being, the picture isn't great. So psychosis is a global prevalence of between 1% and 3%, although it's quite a difficult figure to really ascertain because of the stigma associated with psychosis. Not everybody comes forward with symptoms, but also it depends on where you are in the world or here in Aotearoa, whether you've got access to specialist services as well. But what we do know is that people living with psychosis and other serious mental illnesses have a reduced lifespan of up to 25 years. So it's been called the scandal of premature mortality by Sir Graham Thornycroft. But what we also know is that we can support people to live well with psychosis, and that early intervention is really crucial here. And this is where our kaupapa comes in. That's where our project is situated within early intervention services. So young people, rangatahi, who have been diagnosed with psychosis in the last 6 months or so. So myself, not having lived experience of psychosis, it was really important to recognise that it's really difficult to develop a programme or system support for young people without actually having that lived experience ourselves. So that's why we embedded lived experience on our team. Brian is a prime example of that, an amazing wahine who actually leads the tikang of our project as well, but also gives these amazing insights alongside other members of our team with lived experience of mental distress and or psychosis. So it's been really key for us. And also the co-design project itself is around embedding and centering the importance of lived experience. If lived experience is one of our key pillars for the project, the other one is taking a Te Ao Māori process or approach that really acknowledges and honours Te Ao Māori. So we could take a deficit-based approach on this and say that Māori are overrepresented within psychosis as they are in lots of other health conditions. But actually we like to take a strength-based approach, and models such as Te Whara Tapawhā, and knowing that it's not the only model out there, but really taking a holistic approach to health and well-being. So we don't just see any particular part of well-being that's compartmentalised, we see it as a whole, including the whenua, the land, the roots in Te Whara Tapawhā as well as those, the standard 4. So myself and Victoria, my co-lead, not being Māori, we really wanted to make sure that we acknowledge this in a genuine way and not just in a tokenistic way. So early on we partnered up with Toi Tangata, so that's Crystal from Toi Tangata, helped us to frame up the project. And since then, we've developed lots of tikanga around our project as well, and I'll speak to that in a second. So I'm going to talk to two stages today for the project. So the first one was our first funded part of the project, and that's through Lottery Health. It's all around understanding the lived experience of psychosis and co-designing a system support for well-being for Hauora, for rangatahi. So for this, we use this illustrated framework, which is called Navigating the Puna. So Puna referring to wellspring or water. This was co-produced with our illustrator partners, League of Live Illustrators, so Megan from there, Crystal from Toi Tangata, and one of our lived experience research team. So really it speaks to the process of living with psychosis and going through the health system and just going through life in general for rangatahi and coming to something that looks like well-being or recovery, whatever that looks like for a particular person. So with this framework, we wanted to answer 4 questions. What constitutes a healthy life for young people experiencing psychosis? What are the barriers and facilitators to health and well-being? What the service users, and that includes whānau, want to see in the health system? And what can be done within the constraints of the health system, because all health systems have constraints. Our research approach to this was experience-based co-design. I'm not going to go into too much detail here, but 5 stages going from contextual inquiry, which is all about lived experience, to whānau program revision. And our participants were rangatahi themselves, whānau and service providers. We do have a protocol paper for those that are really interested in the approach that we took, but really today I want to focus on that first one, which is contextual inquiry and how we actually approached to understand the lived experience. So we wanted to take a bit of a different approach because, as we know from our participants and our research team, that often when people are asked their opinions on services and systems of support, it's done in quite a tokenistic way and in ways that don't always give them the opportunity to express themselves that are meaningful to them. So we wanted to meet people where they were, and that meant giving them lots of different ways to tell us their stories. So you can see here, these are some examples, not an exhaustive example list, but some people chose to tell their story through writing. Others we had, this is one big co-design workshop that we had at the start of the project. We had a rako in the office as well, where people could write their experiences on or draw pictures and put it on the trees or the branches of the rako. We had some clay, so people could do some creative expression through that. Mentimeter app, so they could go through their smartphone. Some people chose to use music as a way of expressing themselves. And we see our job as researchers to give people these opportunities to tell us their experiences in ways that are meaningful to them. And then it's our job as researchers to turn that into useful data. And that's what we did here. And again, I'm not going to go too much into detail here, but we did a publication on this. So this one, the Victoria led, that you can see at the bottom. But this was essentially one of the outputs from that. And you can see this is essentially a thematic analysis illustrated by Megan again, who was there at the workshop with us. So all these things that support the health and well-being of rangatahi experiencing psychosis. So all of these are raw quotes from the participants, and then there's some themes alongside that. So hope and optimism, connectedness, identity, empowerment was huge, safety and security, myth busting, and meaning. So if we were going to develop a system support or program, we knew that we had to honour all of these themes and embed them in our program. And that's what we did essentially. So each of our participants actually received a copy of this, a framed copy of this as koha for participating, as well as getting paid, aligned with what our research team were getting paid. I just want to focus briefly on this one. It's quite pertinent to the current talk, I guess. It's around trying to get the basics right. So sleeping, eating, moving, connecting, enjoyable activities. So we know that the general population, when it comes to health behaviours, these sort of health behaviours are quite difficult to adhere to for lots of people. So thinking about the last time, for example, you tried to start an exercise program and how long that lasted, we know that people find it challenging to stick to these health behaviours, whatever they are. But with rangatahi living with psychosis, there's extra layers of complexity and challenges, and not least due to medication. So medication has a huge impact on metabolism, which often leads to rapid weight gain. So this not only has an impact on motivation and self-efficacy, but also has an impact on a person's identity. So, for example, people that pre-diagnosis were sporty or active people find it harder to engage with that side of themselves when they find themselves putting on weight very quickly and not being able to move or engage in the ways that they used to. So this just adds that extra layer of challenge for rangatahi. So this is something we wanted to address as well. So I'm going to fast forward now a couple of years. So we got some more funding through Lottery Health and HRC, and it's all about putting all of that into practice so that all those themes, so connectedness, identity, empowerment, meaning, hope and optimism, safety and security, and getting the basics right, putting those into one program. And that's what I'm going to talk about next. So essentially it was a 12-week program. You'll notice here at the bottom, those last 6 weeks, or the 5 of the last 6 weeks had question marks on them. This is because this was a new cohort coming through for this part of the project. So to be able to empower them to have a say in this program, we gave them the opportunity to co-design. So week 0, we had a mihi whakato, so we gave them the opportunity to be welcomed onto the program, but also gave them the opportunity to co-design that last part of the last 6 weeks. So within that, they chose lots of different nature-based activities, which is really cool. We did some music therapy sessions on that as well. So you can see the different flavors, the different themes that we had in each week, and gave people ways to explore their well-being. And again, pertinent to today, one key thing that we had embedded throughout the program was physical activity. We approached this in lots of different ways. So you can see here some of the traditional sports like basketball. We played some football. We also brought in some traditional Maori games, so some tākaro. I'll talk to that again in a second. Went for some bushwalks, got involved in the garden, yoga. Pablo's art studio was an interesting one because we actually walked to the art studio, which is where they did some identity forming sessions in that and express themselves through art. But yeah, the active transport, actually getting them to walk to the studio rather than getting a bus or a lift or anything. The program was facilitated by Nuka Order. They're our delivery partners. So Jazz and Sam from Nuka Order were amazing in terms of being the anchors for Rangatahi throughout. So it's that opportunity to build whanaungatanga for Rangatahi and give them a safe couple of people to speak to on a weekly basis. And alongside that, we also had a booklet that accompanied the workshops as well, the sessions. So these had our tikanga in it, again developed by Bryony, so some karakia, some whakatoki. We also had some waiata in there, but also some practical elements that went alongside specific themes. So these are just our physical activity examples, some opportunities for people to reflect on what they're doing in those spaces, and also, for example, here movement bingo was one of the things that we had in there. So this was actually gifted to Rangatahi and also early intervention services around the country. So it was actually launched a couple of weeks ago. I just want to speak now to the kaupapa that Stu's been leading in terms of developing guidelines for physical activity to improve mental health. So I'm assuming that Stu might have talked to this just, but you can see here these themes around what we do or how it's delivered, who you do it with, where you do it, and when and why you do it. So I just wanted to reflect on how Te Hau Kori embedded these principles within, so we can actually support not just mental health actually, but overall well-being. So in terms of that, what you do, the key thing for us is that we obviously embedded choices through co-design. We really prioritised engagement. So that was our primary variable, whether people felt engaged in the program, because you can have the best physiologically optimized program in the world, but without people turning up to it, it's not much use. So that was really important that we made sure that people felt engaged and kept coming back. How we delivered it. So we made sure that our facilitators were psychologically need supportive or autonomy supportive. So this is along that sort of self-determination theory, kaupapa. So supporting the needs of Rangatahi in terms of autonomy, competence and relatedness, but also from a Te Ao Māori perspective, ensuring that there's that sense of manaakitanga and whanaungatanga. And speaking of whanaungatanga, also creating those socially supportive environments. And we're especially big on encouraging kotahitanga, so actually people working towards one goal and supporting each other within these spaces. And that was really beautiful to watch, actually. It's something that we noticed as observers, anecdotally, that really people coming together and working on the program. Where we do it, we maximize time in nature to tile. So lots of bushwalks. We got into the ocean, we got into rivers, we went to Zealandia. So lots of different things. And actually a lot of that was chosen by orangutai. So that was really cool to see as well. And then also when and why you do it. So it's really key to point out that all of our stuff was for pleasure and leisure. It was completely optional. We never emphasized specific health outcomes. It was all about just the engagement and the enjoyment. And I'll speak to that in a second when I come to evaluation. So these guidelines are fantastic, I think, in terms of conceptualizing and offering a framework in which we deliver physical activity interventions. But there's one thing that we wanted to make explicit as well in our program that's not explicitly mentioned in the guidelines, but perhaps falls under what you do and why you do it. But that was affording opportunities for cultural connection. So considering the fact that over 50% of our participants identified as Maori, we wanted to make sure that people within the program had the opportunity to connect to their culture, to Te Ao Māori. So, for example, we did have the tikanga in there, and that was really important. So starting with karakia. But when it came to physical activities, is having those activities that spoke to that cultural connection. So we had some tākaro that was run by Tūmatu Ora, who do some amazing stuff within the Wellington region. We also had Modako as well, so that was really cool. So again, accessible for Māori and non-Māori, just to be able to connect to a little bit of that culture, which was awesome to watch and be a part of. I want to speak to our evaluation approach briefly. So when we're talking about we talked about manaakitanga, and that's all about enhancing and supporting people's mana. So when it came to evaluation, that was really key for us. We know that there's certain tensions between research rigor, pragmatism, but we also wanted to make sure that supporting or enhancing mana was the baseline for our program. So any measures that didn't support mana, we just sort of left. We followed the Mana Tāohi framework, which was developed by Ara Tāohi, amazing group of people that are doing some amazing stuff. Jazz on our program we're really fortunate to have Jazz, who was a champion for Mana Tāohi nationwide. So that was really cool. So really embedding that mana enhancing approach throughout the program and amongst the team as well. Now we know that some of the objective measures that some people or some organisations wanted to include in our program, these don't always support mana. So there was some pushback on us not collecting weight from certain funders. But weight, if you think about weight, especially within this group who put on weight very quickly, or there's that rapid weight gain, we didn't want to collect that type of data because it's not mana enhancing, so therefore we left it. In terms of validated psychometrics, we did try to use this early on, but it didn't really resonate with Whaiora. They didn't really understand the questions or didn't really connect with the questions. So we essentially did a truncated version of a self-perceived well-being measure based on Te Whara Tapawhā. So based on Hua Oranga, so that's a Te Whara Tapawhā based measure. And you can see here, these are our evaluation sheets, which we used on a week-to-week basis. So essentially, orangutai would come into the sessions and they would use emojis to tell us where they were. So they stuck the emojis on corresponding to how they feel on those 5 different parts of Te Whara Tapawhā. So including the nature connection, the land, the whenua, the roots at the bottom. So this really gives them an opportunity for people to check in with us, but then also at the end of the session, they'll do it again. And what we did there, we turned those emojis, that emoji data, into Likert scale data. So we've actually got a quantification of where people are at pre and post session. We also did some end of program evaluations. So you can see here some of the feedback forms that we sent out that orangutai filled out with caseworkers and also facilitators around how they felt the facilitators approached them. So whether they felt that autonomy support and other aspects of the program, including social connectedness, which we sort of had an inkling that this would be a really key aspect to the program, whether it was successful or not. And then we had interviews with facilitators, so Nuka Ora, because they were there throughout the program. They really got to see the changes within Rangatai as individuals, but also as a group. So that was really cool to get their perspective. And same for EIS Kaimahi, who are also there. So EIS being Early Intervention Services. They were there, but they also saw Rangatai in between the sessions. So that was really cool for them to give their input on how the program went as well. And then we interviewed Te Whatu Order Management. So this is really about understanding how we can sustain these programs in the long term, because they're really the decision makers. On top of this, we didn't interview participants for the research, but we are producing a documentary. And I'm going to share just a really small clip of this documentary now with one of our participants, but it's quite a rough edit, so bear with me.
There is no better medicine than actually talking to people, especially if they're going through a mental health problem. Chucking meds at them and expecting it to just magically solve everything is asinine, to say the least. So groups like this is what helps people get through mental health journeys. The meds can help. The meds can like maybe make you feel less suicidal or less depressed or anything. But unless you put that extra step forward, which this group does, unless you put that extra step forward, you're not going to heal, you're not going to recover. You're just kind of like float. Yeah, and it's definitely because of like groups like this. It's like, oh yeah, it helps so much.
Sure, like I said, that's a very small snippet. So we're actually in the middle of producing or editing that documentary. So it'll be with us in November, I think. But having those participant voices has been really important in terms of evaluating the program as well. So that's where we are. We're still collating and crunching those numbers and looking at the qualitative data we've got. So I've got no results to show you per se today, but it's all about the process and the approach that we took to engaging with our participants and engaging with research methodology that works for us and works for Rangatai. But I did want to finish on talking about resourcing physical activity initiatives for mental health, because I guess I'm preaching to the choir here, but everyone who's watching this, who's involved in this sector, knows the power of physical activity to have a massive impact on mental health, but not just mental health, for all types of well-being. Like I said, we don't usually compartmentalize mental health, physical health. We look at it as a whole. But the question is, how do we keep resourcing these? So from my perspective, this is where I guess I put a Nuka Ora hat on. One of the key ways that we can support physical activity initiatives within Aotearoa is looking at and tapping into Tū Manawa Fund. So this is the fund that I help to manage at Nuka Ora as partnerships manager. So for those of you who don't know about Tū Manawa, it's a fund that is used to remove barriers to physical activity for tamariki and Rangatai for well-being, for the purposes of well-being. So again, this is a fund that's the kaitiaki of the fund is actually Sport New Zealand, but then locally Nuka Ora administers that in the Wellington region, and every regional sports trust administers Tū Manawa in different regions. But actually Nuka Ora through Tū Manawa have been funding early intervention services and funding the same Rangatai whaiora that I'm talking about in this project, our project, for a number of years now, actually before my involvement in either of the groups. But I did help to write this case study, which just shows the importance, the impact that physical activity can have on recovery for Rangatai in this space. That's really key. The other one, which I think is a little bit untapped, is green prescription. So we know that green prescription is used for things like anxiety and depression, but less so within the areas of serious mental illness like psychosis. And there's obviously an issue here in terms of capacity and competency and making sure that we can actually, if green prescription is being used, that deliverers understand the different sort of contraindications or different aspects of psychosis or serious mental illness when they're delivering programs. But it is an untapped resource that is nationwide, so we should be using it. So things like the Regional Sports Trust Network, because usually it's the Regional Sports Trust Networks or the Regional Sports Trusts that are delivering green prescription, save a few exceptions around the country. So it's really tapping into that. But the things with both of these resources is that they're in sometimes precarious positions. So Green Prescription, I know this year has had some trouble with, or at least some difficulties with Te Whatu Ora in terms of contracting. So that's been really key, because if we can't continue to fund things like Green Prescription for the sake of mental health and all other types of wellbeing, then we might be in a bit of bother in the future. And same for Tu Manawa, which got announced this year around in the budget cuts, so it got reduced by 25%. So all we can do is keep telling those stories of impact and keep trying to drive the importance of physical activity for mental health and for other types of well-being, in the hope that we can actually push forward and continue to deliver these physical activity initiatives, because we know how important they are for our rangatai and for our general population. So that is me, Ngā Nui. So these are all of our team members on our project for Te Hikenga Whaiora. You can hit me up on my email address. We've also got a project website. These are awesome delivery partners, design partners, and funders. And yeah, I'll be open to any pad thai coming up. So yeah, Ngā Nui team, and I'll speak to you soon.
Matthew, I just have one question before we throw it open more generally. I just, this intervention was, particularly focused on, first episode psychosis and these young people that experience psychosis. Would the principles that you've developed, or, the approach, be applicable to other types of mental health challenges that young people or indeed older people experience?
Yeah, 100%. I think so that the booklet that I showed a brief clip of, that's actually been mental health services like mental health addiction have actually asked for copies of that for all mental health services aside from psychosis. So there's not really any mention of psychosis in that booklet, to be honest. It's quite generic. But it does speak. But I guess it's every time you go in there, it's making sure that you're speaking to that specific cohort, and working with them in that way, that approach. So yeah, I think it's an approach that can be taken to anyone. But having said that, co-design is quite resource heavy. And that's the challenge, is actually translating that across. So Te Whatu Ora or Health New Zealand, how do you create a user-friendly co-design process that is actually going to be used? Because we have the resources to do it, because it's research funded. So it's how you embed co-design across the board without taking up too many resources, and that's the challenge, I think, that's coming up.
Yeah, and especially challenge given how stretched our health and mental health services are. Yeah. Thank you again for the presentation, and congratulations again on the amazing work. I loved how these two presentations today spoke to each other and had highlighted several things in common, and particularly that commitment to community, that commitment to green spaces, the agency of people. To have decisions that to be part of the decision.
Yeah, I've got a question for both of you, separate question for each of you, but I just wanted to comment also on the burgeoning bromance in the chat there. So I'm hoping that this means that the connection between you two grows, and the work that can happen across the Tasman grows as well. I'll start with a question for you, Matt, because it actually leads on from where you just finished off. It's around the resourcing, and of course we know that the resourcing goes beyond just the funds. And you mentioned, the intensity of resourcing required around co-design. A question I had was examples that you know of, or in New Zealand or beyond, of similar programs, or if someone else who's on this call, because we've got representatives from across the country and internationally, was interested in moving this stuff forward, what would the first key steps be getting this going? Because it's clearly, as you said, a resource-intensive process. But what would be the first steps you would advise to someone in moving forward?
Yeah, I think it's a great question, because it is, that resourcing question isn't about funding. It's about partnerships. It's about those connections you have with people, and the network that we've created around Wellington it's become so strong because of that. Just the capacity to be able to go and have coffees with someone and just connect. So just on that. But also Stu mentioned earlier about that connection between sports clubs, for example, and mental health providers and local community services. And I think that's so key, is just making that connection. And, we do come back to that, the whakawhanaungatanga process, right? Having the opportunity for people to come into spaces, into these neutral spaces, so they can connect and understand each other's work, and create opportunities for that. Because I think it's just information sharing and skill sharing, and that goes a huge way. The reason that our co-design process is so resource intense is because we were starting from scratch. So I think if that's facilitated some way, and for example, some connector roles within the community in this space, that would be really key. And I think here in New Zealand, RSTs are really good, really well placed for that. But they don't exist yet, and then funding's also an issue. So yeah, so those connector roles, I think, would be the way that I would look at going forward with it personally. But yeah.
Justin, did you
want me to fire
yeah,
Stu now?
I think so. We've got nothing else coming in the chat, but put your hand up if you do have a question.
Thanks, Matt. That's super helpful. Stu, the comment that came in the chat earlier from Hillary around how practical your guidelines were, I fully appreciate, and I think it's a great part of what you've presented there. And I really like the way you sort of even laid out a 90-day plan as to how you could go about this. I wondered if you were aware or could share of any actual examples where you've seen this happen, and if not, what you might see as potentially the pitfalls or the opportunities, that perhaps maybe the barriers that people might run into in implementing that 90-day plan, and what your advice might be for those people. So concrete examples, or if not, those barriers or facilitators there.
Thanks, Justin. Really appreciate your positive comments, and we have seen through a number of clubs some of the pitfalls, and those are mostly around just human resources. And so it's, you get clubs who someone is really enthusiastic and they take it on for all the right reasons, but then it falls by the wayside because they get busy, life gets busy, and if they're not driving it within the club, no one else is driving it, and then it just stops. So for me, that's definitely the biggest one, and I'm sure it's a global issue around just the resourcing of community sports organizations. They're not well resourced, and so this is, I think, always going to be an issue. The opportunity for us, I think, is in developing a product that is more than just a PDF. That's what we have at the moment, but we're committing a lot of resources to try and make this as easy as possible for sports clubs. So whether that's, giving them, just the templates, whether that's some sort of AI enabled kind of program or platform where they can just answer a couple of questions and it might spit out their mental health action plan for them. But in the end, no matter how easy we make it, it's still going to come back to someone within the club picking that up and driving it. And that has a number of issues. The first is turnover, and then it's just the sports clubs, I think, recognizing and incorporating mental health and mental health promotion into their kind of their values, their mission, their core business. So they're the two kind of big things I would say, is having that explicit focus on behalf of a club to do that, and then making sure it's resourced, and making sure it's resourced is probably not the right term, but trying to enable resources in a very low resource environment is always going to be the difficulty.
Mm-hmm. Thank you.
Thanks, Stu.
Yeah, thanks so much, Stu. Such a real challenge, but putting the kids in particular at the heart of these decisions sometimes helps us find the right resource, doesn't it? When we're doing that. Is there one more reflection or comment of any of the participants on the call? Oh. There's a question here, another one from Hillary here. A question, Matthew, she's just asking whether you've presented this work back to the National Mentally Well team at Te Whatu Ora. Has that been an opportunity you've had?
No, not yet. It's on the cards. I think. Well, we haven't actually started to organise that. This is probably it's only the second time I've talked about the project since finishing the program. So yeah, I'll start that dissemination thing now. I mean, our first priority is always community and going to them first and talking about the results and the process, and then it's to the providers afterwards. I'm trying to flip that pyramid, invert the pyramid a little bit.
Brilliant.
Yeah,
Well, Hillary might be well placed to make an intro for you, so it'll be great, a great outcome. Yeah. I'll just wrap up. Firstly, just on behalf of Sport New Zealand, to just acknowledge and thank our partner in the seminar series, Victoria University of Wellington's Te Hau Kori. We really appreciate and value our partnership to be able to bring you these things, as well as sharing Justin. Also, just a huge thank you again to both of our speakers who've come and beamed in from overseas and navigated various challenges to present to us. And just the way that your presentations spoke to each other was a real highlight for me. And then I guess just finally, before I close with karakia, just a heads up about our next Te Hau Kori Sport New Zealand seminar in this series. Our next one focuses on the role of physical activity in educational outcomes. There's huge focus in New Zealand at the moment on increasing rates of student attendance and student engagement and achievement. And our next seminar will explore ways in which a more deliberate focus on inclusive and positive physical activity can contribute to some of those outcomes. So we look forward to joining you then. Just finally, as we close, just a reminder that so many of these things that we've learned today are applicable across government and applicable in different ways, but they're also applicable to us in our own lives. So making ourselves, being deliberate about them, not just during Mental Health Week, but taking some of these advice to ourselves is probably also a really great step. Let me close this session with karakia. Kia tau, kia tātou katoa. Te atawhai o tō tātou araki, te ihu karaiti, me te aroha o te atua, me te whiwhinga tahitanga, ki te wairua tapu, ake. Āmene. Taki te ano.